We have done 4 studies and published those studies. Those are peer-reviewed studies. They were conducted by outside forces. Nobody in our company was involved in the clinical studies themselves. So that's what it means to be from the outside and peer-reviewed. The first study was 60 subjects, and we compared the AVI foot pump to our device, Footbeat. And in that study, it was a predicate really of Footbeat, and it was called Leapfrog at that time. And what that study showed was that the amount of blood that we produce increased venous velocity. Both the posterior tib and the knee is a little bit less than what is produced with the big pneumatic wraparound pump called the AVI pump. However, it's much more consistent in the results. So what is really important is the consistency, so that you're not putting it on somebody and then not getting a result from that. The second study that we did was on elite cyclists, and this was done at the University of Colorado. And 16 elite cyclists were divided into two groups, a control group and the group with Footbeat. They were on ergonomically braked bicycles, and literally the end point was when they were so fatigued they were ready to fall off the cycle. The group that used our device used it for 4 hours, 1 hour immediately after, and then 3 hours later that day. They were kept on the same sort of diet and the same activity level. And the group that used our device was measured from day 1 to day 2, and they did an 18% better in riding their bicycle than the other group, and 12% from day 2 to day 3. And they also washed out their lactate much faster because of the increased removal of metabolic waste. The third study was a study that was done comparing Footbeat to graduated compression stockings, and these measurements were taken 30 minutes before, 10 minutes before. Then we actually turned the Footbeats on 10 minutes after and 30 minutes after. Footbeat increased the venous velocity by about 380% at the knee, and graduated compression stockings did not improve statistically the venous velocity at all measured at the knee. And the last study was just a single case study that reviewed the use of Footbeat for plantar fasciitis. This was a lady who had had plantar fasciitis that was addicted to running. She couldn't stop running. She had had it for 3 years, and she had had multiple interventions done, including injections and exercise program, custom orthotics. None of them helped, and she used Footbeat, and within 6 weeks she was about 90% pain-free, even though she didn't stop her running during that period of time. So this is just a case report, but it really goes into all the treatment of plantar fasciitis.